that it is really extraordinary to me that we would have a candidate for governor who proposes giving the wealthiest Vermonters, 1,400 of them, an income tax cut, and then throw 2,500 Vermont kids off of Dr. Dinosaur by 2013. That is a plan that is reckless and irresponsible.
Those trays already been growing 11% every year, and you want to put another 2,700 eligible children into Dr. Dinosaur. How much of a cost increase is that?
Well, let's be clear first about what the challenge is there. The first question I would ask is, why do we still have 2,700 Vermonters who are eligible, but for which the outreach has not worked? We know that in the end, we save money when we insure kids. Let's not forget that children are the cheapest people to insure. When we have adequate primary preventative care for them, it saves the system money later on. We're all agreed on that. So the question is, why have we not succeeded in getting those 2,700 Vermonters covered? And the answer, in my judgment, is we use a company from Virginia called Maximus to do the outreach to Vermonters to get those kids on. I would make sure that we have Vermonters reaching out to Vermonters to get those kids covered. I would say to Maximus, we don't need to do that in Virginia. We can do those jobs right here in Vermont. Vermonters understand Vermonters. We can get them signed up.
But how much will it cost to add 2,700 kids to the program?
Well, I can't tell you the exact number. I can tell you that it's cheaper to cover them than not to cover them, because otherwise the health we all pay for it when they show up in the emergency rooms, or they become sicker because they've been primary.
You say Dinosaur is 11% annually for 4 years?
That's correct. Over the last 4 years, it's gone up 11% annually. But let's not confuse that with inflation increase. It includes what Bianca's talking about. That includes the number of Vermonters that we succeeded in bringing onto the program, plus the inflation increase.
I was talking to an administration official last night who was saying that revenues appear to be flat, and yet caseloads, he expects, will continue to rise because people are still losing their houses, they're still losing their jobs. You know, if the economy doesn't really, he doesn't expect the economy to improve dramatically at all, just really sort of inch up. And, you know, that seems like a magnifying factor for the budget over time. Because part of, I think, what everyone was banking on at one point was the idea that those caseloads would drop and you'd see some savings. So what do you do if caseloads continue to increase in other areas of the state budget, like Reach Up or...
Let's ask why revenues are flat. Revenues are flat because we've had an administration, which Brian Dubie has been a part of, that have lost 10,000 private sector jobs, that have led to a middle class in Vermont being decimated by higher costs and reduced earnings. We need a governor who has been creating jobs all of his life, working life in Vermont, who knows how to create jobs and get the economy moving again. Here's the question. If you're happy with the way things have gone over the last 8 years, if you feel you're better off financially as a Vermonter, if you feel as the middle class like things are better for you, more affordable, more jobs, more prosperity, stick with the team together. If you want jobs, if you want someone who's been creating jobs all their working life in Vermont, balancing budgets, showing they can get tough things done, has a vision for how to create those jobs, elect the new team. I'll create jobs and get revenues growing again.
Those joint fiscal numbers, are you saying that they came up with the figures, the 455, the 900, the 2,500?
I'm saying that if you take the joint fiscal budget numbers, you take the VISCA numbers of who's not included right now, and you put a 2% cap on growth after next year, this is the result.
And did you ask joint fiscal to look at these numbers for you?
I took their budget numbers and then I applied Brian's cap to those numbers.
Can you talk a little bit about your other proposal to balance the budget, which was turning corrections expenses? First, I think it was $40 million a year, and now it's $40 million over several years. Haven't you changed your position on that?
I never did. If you read my plan, it says very clearly, there's only one paragraph on this, and it says very carefully, transitioning would. And we throw out the math so Vermonters understand what we're spending in the plan. As I've said, and as others have observed, this campaign is unlike other campaigns in Vermont. in Vermont, when someone says something, that is what we believe to be true. When you run ads that smear someone's character and distort what they have said, then people become confused. I never ever said I was going to let anyone out before their time was up. I never ever said that I was going to save $40 million in the first year.
Peter, you're talking about ads that sort of distort someone's character. What about the Pinocchio ad? That seems kind of...
You know, here's the distinction. If, in fact, I make a statement like IBM is going to leave the state in 2 years if Vermont Yankee isn't relicensed. Like, I have a list here in front of me of all of the criminals that either someone's going to let out of jail, sex offenders and drug dealers. And in fact, neither of those things are true. Put it up on the air. I should be telling the truth, so should Brian. If an ad comes out and says, hey, Peter Summer's going to let sex offenders and drug dealers and criminals in the streets cut all these jobs and so forth, and it is not true, that is not how we do it in Vermont. There is a distinction here. I'm going to run an issue-oriented campaign. I pledge to do that. I think Vermonters are both disgusted and discouraged by the tone of Brian's campaign. I'm not going to go there.
Do you think that Brian Dubie wants to see 2,500 kids go off Dr. Dinosaur?
Brian will have to speak for himself. We have a responsibility when we're running for governor to make proposals on things like budgets and then understand what the consequences of those decisions are. The result of a 2% spending cut over the next 3 years, 2013, 2014, 2015, is what I just outlined.
But Brian's telling us much the same thing that you are, that, look, this is going to be a conversation between the next legislature and the next governor about how we get to where I want to go. You can't tell us specifically how you're going to avoid...
I can tell you specifically, Peter, that if I propose a 2% cut in 2013, 2014, and 2015 across the board, I will be proposing cutting 2,544 kids off Dr. Dinosaur in the third year. There is no other way I could do that. Therefore, I have not made that proposal. I would not make that proposal. I think it's fiscally irresponsible, particularly when the goal is to give 1,400 wealthiest Vermonters an income tax cut. That is not a choice I would make. That's the choice Brian has made. It's a discussion we should be having in Vermont. What does it mean? No one has yet asked, what do these caps mean? We're going to be looking at the caps. Here's your first vision of what they mean.
So, oh, thank you. I was just going to ask you about the 7 days ethically challenged thing. I mean, do you have a response to that being used in an ad? I mean, how do you feel about that? What do you think?
I think Vermonters are so sick and tired of a campaign that is a campaign of distraction and distortion. And I'm not going to respond to every distraction and distortion that Brian has thrown at us. That's what they want. They have no plans to create jobs. They have no plans to responsibly balance budgets. They have no plan to provide health insurance for all Vermonters. They have no plan to get internet and broadband every last mile by 2013. The list goes on and on. Let's focus on what Vermonters care about. When I go out and talk to Vermonters, whether it's Senator Patrick Leahy or someone who's working a hard job in a factory, they say to me, please, let's talk about the issues. That's what I'm going to do.
Thanks.